welcome back. You know, health officials are increasing testing for COVID-19 patients in Connecticut. Almost 7,000 people have already tested positive, and there have been 206 deaths. This morning, we are joined live by Governor Ned Lamont with an update. So good morning to you, Governor, and thank you for joining us this morning. We're both in our respective homes this morning, keeping safe.
Good morning, Dan.
So I want to begin this first with testing ramping up statewide. How is that looking for you? 26,000 tests have been administered, but what's the plan ahead to add more testing as we see more and more people wanting these tests?
We are ramping that up. Semaphore, a big biotech company, is going to be adding on about 1,000 tests a day very soon. We can test all the frontline workers, everybody in critical care, increasingly, hopefully, more broad-based testing. And now we're beginning to think very seriously about the antibody testing as we think about what happens as we ramp down from this peak of the crisis, how we can get younger folks back to work. And as you know, the antibody testing will determine whether or not they have an immunity to the COVID or not. They'd be the first workers back to work.
Yeah, we'll be actually interviewing an individual who had COVID-19 and is now donating his plasma moving ahead. He's coming up in just a few minutes. But, Governor, I want to ask you, you certainly do have a high number of cases, but not as high as we've seen in New York or New Jersey. What do you credit that to? Was it taking what you saw in other countries and what happened in New York and moved quicker than other states or countries did?
Well, Governor Cuomo, who's been an extraordinary leader on this, and myself, we've worked hand in glove along with Phil Murphy. I think we benefited a bit from two things. One, when we put in the social distancing at the same time as New York, our pandemic was probably a week or two behind New York. So fortunately, we were able to do it a little bit earlier. And frankly, we're just a little less dense. And that means social distancing comes more naturally to us here in Connecticut. That said, look, as I said yesterday, when New York City sneezes, Connecticut catches cold. So we are seeing a ramp up in our infections. But that's less the metric I look at. I look at hospitalization because that really determines what you see in the broader community. In fact, testing is just so hit or miss on the infection rate.
Yeah, and that actually brings me to my next question. Now, you're bringing up hospitalizations right now in terms of resources. We've heard that here in New York City, this certainly can be the apex week, and they need those ventilators, right? How is the state of Connecticut in terms of personal protective equipment for those who are on the front lines? And what about this battle that you have seen now play out between governors really trying to barter for the supplies to come to their state? Have you been involved in that? Do you see that happening with other governors?
Oh, absolutely. But, you know, first of all, in terms of our supply, our healthcare system, our amazing hospitals working together as one, no more independent fiefdoms. We're mixing and matching, sharing personnel and equipment as needed, making sure it goes to that part of the state most in need, which right now is, Fairfield County. And so we are bending but not breaking, as I say. We still have capacity. We planned accordingly. But, yeah, it's like a madhouse out there in terms of trying to buy this equipment. You try and go through the established channels, the Walmarts, McKessons, and the such. But increasingly, legitimate materials are going on to the black market, the gray market, where prices jack up like surge pricing on Uber.
And what have your communications been like with the federal government? The president has said repeatedly now that this is up to the governors to get their supply, right? That he has the stockpile, the federal stockpile, but it's up to the individual governors to move forward in getting their supplies. Have you had communication with the federal government and the president, and what is that looking like?
No, very much. They've opened up the communication in a serious way over the last month or so, which is very helpful. Hey, look, only they can source ventilators in China. You can't ask Connecticut to try and do that by itself. We're trying to put together a regional consortium of different states. Maybe that helps a little bit. But, yeah, look, I'm not putting it all on them. We're the ones that can expand capacity in our hospitals. We're the ones that can get more ICU rooms. We're the ones that can get, more nurses back off the sidelines on the front lines. So we've got to step up as well, and I think we have.
And, Governor, I'm out of time here, but I do want to ask you one last question. There have been rumors and reports of you instilling a kind of martial law for the state of Connecticut. But moving forward, do you have any plans to go stricter in terms of social distancing guidelines? We see some towns in New Jersey now saying do not leave your home at all.
We're following this very carefully. But I got to tell you, Dan, so far, in most cases, like almost all cases, People are taking the social distancing seriously. Metro North is ridership is down by 95%. I do watch the parks very carefully, make sure that people keep their distance. This is the 2-week period where you must stay at home because this is the peaking time where the infection rate could be at its highest.
Understood. Governor Ned Lamont, I do appreciate you joining us this morning here. When this is all over and said and done, I'd like to have you come to our studio so we could actually meet in person, all right? So we're not talking to each other from our living rooms.
Look forward to meeting you, Dan. Thanks for what you're doing. Kill
Stay
those
safe,
rumors.
and thank you for your leadership. Yeah.